Ever feel like healthcare speaks a whole different language? I know I do, especially when it comes to Medicare. But what if I told you understanding Medicare is less about like memorizing a medical dictionary and more like unlocking a personalized health plan, one that's designed just for you? That's what we're diving into today.
Yeah, it's a common misconception that Medicare is one size fits all. But the truth is it's more like a toolbox, actually.
Mm.
And we're going to help you figure out which tools are essential and which ones you might need based on your own, unique health needs.
I love that analogy. So, no need to become a Medicare expert overnight. Let's start unpacking this toolbox, shall we? Now, many people, they think of Medicare as just one thing, but I've heard those terms, Part A, Part B. It's a lot.
You're right, it can feel like a lot, but it's all about breaking it down. So let's start with the foundation. Original Medicare, which consists of Part A and Part B. Think of these as the two main tools everyone gets.
Okay, original Medicare, got it. So, what's in this dynamic duo? What exactly does Part A cover?
Part A is your hospital insurance. It's there for those big what-if scenarios. Unexpected hospital stays, skilled nursing facility care after a hospital visit, even hospice care. It's there to provide a safety net for those, major health events.
Okay, so Part A is there for those bigger health concerns. That's reassuring. But what about regular doctor visits or like those essential checkups?
That's where Part B steps in. It's your medical insurance for outpatient services. They get doctor's appointments, preventive care like those annual flu shots, and even mental health services, which are, crucial for overall well-being.
It sounds like Parts A and B work together to cover a pretty wide range of healthcare needs. But what about the cost for all of this?
That's the thing about original Medicare. It comes with both premiums and cost sharing, like deductibles and coinsurance.
Mhm.
Now, here's a valuable perk. Most people don't pay a monthly premium for Part A. If you or your spouse worked and paid Medicare taxes for at least 10 years, consider it a well-deserved thank you.
Wow, that's huge. So Part A is like a built-in benefit for many. What about Part B?
Part B does have a monthly premium, usually deducted directly from your Social Security benefits. However, the good news is that there's a provision called hold harmless that can protect most people
Mm.
from significant premium increases year over year.
Hold harmless. That's interesting. Tell me more about this provision.
Essentially, the hold harmless provision ensures that your Part B premium won't increase faster than your Social Security cost of living adjustment from one year to the next. It's designed to protect your income and make those premium increases more manageable.
That's a relief for many, I'm sure. So we've got our base covered with original Medicare, but I've also heard about Medicare Advantage or Part C. How does that fit into the picture?
Think of Medicare Advantage or Part C as, kind of an alternative route. It's like choosing a different healthcare experience while still being under the umbrella of Medicare.
An alternative route. Intriguing. How so?
With Medicare Advantage plans, you're essentially choosing a private insurance company that's approved by Medicare, of course, to handle your healthcare coverage.
So instead of going directly through original Medicare, you're going through a private insurer.
Exactly. These plans are required to cover everything that original Medicare Parts A and B cover.
Yeah.
The catch is that they often come bundled with extra perks like vision, dental, or even hearing coverage, often for little to no additional cost.
So it's like getting a package deal with Medicare Advantage. That sounds appealing. But there must be some trade-offs, right?
You're right, there are always trade-offs. While Medicare Advantage plans can offer convenience and extra benefits, they often come with networks of doctors and hospitals, meaning you might need to stay within that network to get, the most out of your coverage.
So if you're someone who values flexibility in choosing their like healthcare providers, that's something to consider. It's all about finding the right fit for your, I guess, individual needs and priorities.
Exactly. Now, we can't forget about prescription drug coverage, which is where Part D comes in.
Yeah.
This is a crucial tool in the Medicare toolbox, especially as medication costs can, really add up.
Absolutely. Part D can be a lifesaver, but I know it can also feel overwhelming. How do you even choose the right plan when there are so many options?
You're not alone in feeling that way. The key is understanding how Part D plans work. Each plan has a formulary, which is simply a list of the drugs they cover. Think of it like a restaurant menu. Each plan has its own selection.
So you need to make sure the plan you choose serves the specific medications you need.
Precisely. And here's where it gets, kind of interesting. Not all formularies are created equal. They often have tiers which determine how much you pay for your medications.
Cheers! Like levels of cost sharing.
Exactly. Imagine those tiered loyalty programs. Tier 1 drugs are typically your lowest cost generics. while Tier 4 or 5 drugs might be your higher-cost brand name medications.
So even if a drug is covered by your plan, it might not be the most affordable option, depending on which tier it falls under.
You got it. That's why carefully reviewing the formulary and tiers of different Part D plans is crucial, to ensure you're getting the most cost-effective coverage for your specific prescriptions.
That's incredibly helpful to know. It's like finding the best deals, but for your medications.
Exactly. Now, let's not forget about another important piece of the puzzle, Medigap, often referred to as Medicare supplement insurance. While not technically a part of Medicare, it plays a significant role in filling coverage gaps.
Medigap. Okay. I've heard that term thrown around. Is it like extra insurance on top of your existing Medicare coverage?
You could say that. Think of Medigap as a safety net that helps cover those out-of-pocket expenses that original Medicare doesn't, like copayments, co-insurance, and deductibles.
So it's like an extra layer of financial protection.
Exactly. It can provide peace of mind. But it's essential to understand that Medigap plans don't cover everything. For instance, they typically don't cover long-term care, routine dental or vision, or hearing aids.
So while Medigap can be a valuable addition for some, it's not a catch-all solution.
Precisely. It's about understanding your needs, assessing your risk tolerance, and deciding if that extra layer of coverage aligns with your, healthcare and financial goals.
This is all starting to paint a clearer picture. We've got original Medicare with Parts A and B, the alternative route of Medicare Advantage or Part C, and then the supplemental option of Medigap.
And don't forget the crucial Part D for prescription drug coverage.
Right. See, so much to remember, which is why understanding those Medicare enrollment deadlines is so important. It can feel like a maze, especially for those new to Medicare.
You're telling me. Missing these deadlines can lead to costly penalties and gaps in coverage. So let's shed some light on those crucial enrollment periods. The first one you need to be aware of is your initial enrollment period, or IEP for short.
IEP sounds official. When does this window of opportunity open up?
Your IEP begins 3 months before the month you turn 65 and extends for a total of 7 months.
So you have a good amount of time to enroll, even if your 65th birthday isn't right around the corner.
Exactly. This 7-month window gives you ample time to research your options and make informed decisions about your Medicare coverage. However, missing this initial enrollment period can lead to those unwanted late enrollment penalties, particularly for Part B and Part D.
Penalties are never fun, especially when it comes to healthcare. What if someone misses that initial enrollment period? Are they out of luck?
Not at all. Medicare has a backup plan, the General Enrollment Period, or GEP. This enrollment period runs from January 1st to March 31st each year.
Okay, so there's a safety net for those who might miss that initial window, but I imagine there might be a catch.
You're right, there's a trade-off. While you can enroll in Medicare during the GEP, your coverage won't actually start until July 1st of that year. And depending on your situation, you could still face those late enrollment penalties.
So it's really in your best interest to, aim for that initial enrollment period whenever possible.
Absolutely. It's all about minimizing potential costs and ensuring you have the coverage you need from the get-go. Now, there are also special enrollment periods, or SEPs, designed for specific situations.
Like what kind of situations?
For instance, if you're working past 65 and covered under an employer-sponsored health plan, you qualify for a SEP. Once your employment ends or your coverage changes, you'll have a limited time to enroll in Medicare without incurring penalties.
That makes sense. It provides flexibility for those who might not fit into that traditional retirement timeline. But with all these different enrollment periods, it's easy to get overwhelmed.
You're right, it's a lot to keep track of. But here's the good news. Medicare has an annual reminder built right in, the open enrollment period. Think of it as your yearly opportunity to review your Medicare coverage and make any necessary adjustments.
Ah, yes. Open enrollment. It's like the Black Friday of healthcare.
I love that analogy. Mark your calendars, because open enrollment runs from October 15th to December 7th each year. This is your chance to switch from original Medicare to a Medicare Advantage plan, change Part D plans, or even go back to original Medicare if you're not happy with your current coverage.
So it's essentially a chance to reassess and make sure your Medicare coverage is still the best fit for, your evolving needs and healthcare landscape.
Exactly. Now, even with the best coverage, it's crucial to understand that Medicare doesn't cover absolutely everything.
Right. There are those gotchas that can sometimes catch people off guard.
Exactly. And it's essential to understand these potential gaps in coverage so you can plan accordingly and avoid any surprises down the road.
Let's unpack some of these gotchas so our listeners can be as prepared as possible. Where do we even begin?
One of the most significant areas, not typically covered by original Medicare is long-term care. This includes services like nursing home care, assisted living, and custodial care at home.
Those are essential services, especially as people age and their needs change.
You're absolutely right, and it's something that often gets overlooked until it becomes, well, kind of a necessity. Another area where people are often caught off guard is dental care.
Wait, Medicare doesn't cover regular dental care, like cleanings and fillings.
Unfortunately, original Medicare typically doesn't cover routine dental care. It's the same story for routine vision care, like eye exams and eyeglasses.
So those are expenses you'd need to factor in separately, either out of pocket or through supplemental insurance.
Exactly. Another area often overlooked is hearing aids. Original Medicare doesn't cover the cost of hearing aids, which can be a significant expense for many.
It's like they say the eyes, ears, and teeth don't get much love from original Medicare.
Sadly, it's true. And speaking of things original Medicare might not love, let's talk about traveling outside the United States.
Ah, yes. For those adventurous souls who want to explore the world during their retirement years.
Exactly. It's important to remember that Medicare generally provides very limited coverage if you need medical care while traveling abroad.
So if you're planning on, jet setting around the globe, it's crucial to do your research and consider supplemental travel insurance.
Absolutely. It's always better to be safe than sorry, especially when it comes to healthcare costs in a foreign country.
Wow, this has been, really eye-opening. We've covered so much ground from understanding the different parts of Medicare and, those potential coverage gaps to navigating enrollment deadlines. It's clear that, knowledge is power when it comes to making, those informed healthcare decisions.
Absolutely. And remember, we've just scratched the surface here. Medicare is a complex system, a lot of nuances,
Yeah.
and what works best for one person might not be the best fit for another.
So true. As we wrap up our deep dive into the world of Medicare, what are some, I don't know, key takeaways? What do you want our listeners to really remember as they kind of embark on this new chapter?
First and foremost, remember that you're not alone in this journey. There are resources available, people who can help you every step of the way. Don't hesitate to reach out to Medicare directly or, consult with a trusted financial advisor to get some personalized guidance.
It's like having a guide in the, well, often complex world of healthcare.
Exactly. And when it comes to choosing your coverage, whether it's original Medicare, a Medicare Advantage plan, or supplemental options like Medigap and Part D, take the time to carefully consider, I think, your needs, your budget, and your healthcare priorities.
It's all about finding that perfect fit for your, I guess, individual circumstances.
Precisely. And remember, this isn't like a set it and forget it decision. Your healthcare needs and the healthcare landscape are, constantly evolving. That's why it's crucial to review your coverage annually during open enrollment and make adjustments as needed.
It's like giving your Medicare coverage an annual checkup.
I love that. And lastly, don't be afraid to advocate for yourself. Ask questions, do your research, and make sure you're getting the most out of your Medicare benefits.
Those are fantastic takeaways. This deep dive has been incredibly insightful, and I know our listeners are feeling, I hope, much more prepared to navigate the world of Medicare.
I hope so. Remember, knowledge is power. And when it comes to your healthcare, being informed is, honestly, the best way to ensure a healthier and happier future for yourself.
Couldn't agree more. That's it for today's deep dive into Medicare. Until next time, stay curious, stay informed, and take care of yourselves.